dentistry is literally the only medical field where a dead organ is allowed to stay in the body.
Kalimera from Sentosa, Cyprus, Limassol. Today we're joined by Dr. Ioakim Heiler, a biological integrative dentist who's redefining the way we understand oral health, not just as a local issue, but as a window into our entire body. I want to welcome you to Cyprus. We've always been looking for a biological dentist, which we've never had before. And now we have you here. And we want to understand and help us define the importance of having biological health and dentistry.
Yes, thank you very much, Dr. Andri. It's a big pleasure to be here today, to be talking with you about all these topics that are really fundamental for our overall health. And just to tell you a bit about myself.
Yes, please.
I've been studying dentistry in Germany. I graduated in 2005, so at that time I was still doing traditional or orthodox dentistry, nothing complementary, nothing alternative or biological or anything. I was focusing on dental implants straight away after my studies and started putting dental implants after a year. So I've done many titanium implants, and basically the point where I questioned what I was doing, I was having two comparable cases in patients. In both I put dental implants. In one I had wound healing difficulties and complications, and in the other one I haven't. So I kept asking myself, why was that? I have followed all the guidelines I was taught up to that point. And then I turned to all the energetic aspects and nutritional aspects and got into acupuncture. I started my education with the DAA, with the German Acupuncture Association, as well as my studies with SDS in Switzerland. SDS is the Swiss Biohealth Clinic by Dr. Karl Ulrich Volz in Switzerland, at Lake Constance. And then I got to hear about the big role of vitamin D3, of vitamin C in bone metabolism. And ever since I focused on that one, I don't put any titanium implants anymore.
And what brought you to Cyprus?
It's the weather and the warm-hearted people, basically. So in 2015, I started my biological journey. I switched that 10 years ago. And in 2021, I decided to sell my practice in Germany because it just seemed... I just couldn't bear all these circumstances anymore, and still in Cyprus there's loads of common sense still working in the people.
That's good to hear.
Yes, there is definitely that.
Very good.
Yes, and then I've decided to come here, and always looking for fellow doctors and holistic treaters, practitioners, to build up a network where you have loads of exchange, not only patients, but also professional opinions or alternative treatments.
Yeah, the integration is very important.
Yes, and that's basically how we met.
Yes. I was very pleased to meet you because the integration of biological dentistry with biological holistic health is very, very important today in a patient who needs to look for health and wellness, because both the jaw and the teeth and the mouth are connected to the whole being and the way of our immunity, how it works, and the stability of our emotional factors, and I believe many more, which you will be telling us at a later stage.
Yes. Well, the thing is, just to keep up on that, we have all the energy meridians running through the jaws, and such as in no other region of the body. So if there's any like chronic inflammation or root canal teeth that are disturbing, it affects via this remote effect other organs, joints, functionalities, and outbalances the various functions within the body.
And I believe a lot of people don't actually know about this. So we would like to explain this to patients and get them to know that this is available. And I believe it's a very important part of information that will help them to succeed in healing themselves once they've had this, let's say, blockage removed.
Yeah. If they get to that point that they have the feeling that traditional medicine or just medication doesn't get them any further, or in the worst case, gets them worse, after years, they might open up their brain a little bit and their horizons to see this.
So what actually led you to explore holistic or biological dentistry? What was the turnaround?
As said, it was these two cases where I didn't really see the reason why it wouldn't work, why the implants didn't work, and well, only in one patient where I had these wound healing difficulties, and I didn't pay attention in those days to the vitamin D3 level. Okay, I realized, okay, was it a patient with diabetes? Was it smoker, non-smoker? And so evaluated it a bit, but I didn't go into details such as measuring vitamin D3 levels, which we do nowadays as biological dentists. We have D3 measured, we have the LAC, LDL measured in order to create a healthy space for the bone to heal.
Right. So what you're trying to say is that without the correct amount of vitamin D absorption, you have dental issues.
Most definitely, the bone metabolism is compromised, and so you will get wound healing difficulties, especially around implants. When it comes to implants,
would you include the vitamin K with that?
Yes, always.
Always,
The right ratio. Yeah.
That's very good.
Most definitely.
How would you describe the main difference between conventional and holistic dentistry from your point of view?
Well, I think that traditional dentistry has basically three focuses. Number one, absence of pain. Number two, functionality. And number three, aesthetics. And that's basically all they do. Well, absence of pain and chronic inflammation. Okay, if we include periodontics to it, but it's not going further. And the teeth and the jaws are basically a unit. And we, as holistic or biological dentists, we also, as said, see these meridians running through the jaws. And so in any problem we have in the jaws, we have these remote effects that can affect joints, organs, and other systems. So that's basically the main difference, that we include other systems, and we include also the emotional or stress factors. Whereas the traditional dentist says, okay, it's stress caused, I can't do a thing. Whereas we as also acupuncturists, we can be working on that. We can be working on the stress, reduce the stress, do trauma therapy, for example, and do ear acupuncture to give relief directly to the TMJ, which I love to do in bruxism.
Fantastic.
And yes, and these biting templates you give to bruxism, it stops the abrasion of the teeth, but it doesn't go to the core or to the root.
So it's not really the answer.
It's not the answer. It just prevents further damage. That's all it does.
So how would you describe your overall philosophy of care?
Well, as said, we integrate the emotional status. We integrate the other interference fields, such as scars. We integrate nutrition, which is a really big deal because, as many studies have shown, nowadays all the fruits and vegetables contain about 10% of vitamins and trace minerals they used to contain about 50 years ago. So there's a huge gap of what we are offered, we can have, and what we should be having in our bodies, even if we only ate like veggies and fruits, and there's still a lack of micronutrition. So we have to do supplementation. There's absolutely, yeah.
So you would actually measure a patient and find exactly what deficiencies they have?
Not really. I mean, there's certain key factors such as vitamin C, vitamin D3, magnesium, folic acid, CoQ10, which we need for proper bone healing, and these are integrated in the anti-inflammatory
Protocols.
diet protocols.
Yeah.
Yes, they're integrated.
This is where I believe that the joint effort of our work as holistic chemistries to dentistry, we have the capability of assessing whether a patient has got that deficiency. So we know for a fact that if somebody has a deficiency of magnesium, we can definitely integrate it into the biological dentistry, which will help the patient to have much better results.
Most definitely, and especially with the bioresonance, with the bioresonance devices, we have so many more possibilities because getting these lab analysis done, that will cost a fortune, you know.
Yes.
Going through all those vitamins, that's hundreds of euros, like spent on diagnostics.
That's a fact. I think the most important factor is, like you said, is to make sure that we have a good absorption of the vitamin D. And because most analyses are done in the blood, we are actually measuring the vitamins and the minerals directly in the bone area and in the cell.
Okay.
So that gives us an important notification whether that patient is absorbing the vitamins through their foods or if they're lacking.
Yeah.
And that's a very good treatment that we can put together for patients.
Most definitely. And as well, these blood analysis is always just a momentum, right? And if you do it the next day, it can be right.
Yeah.
So
There can be a variability.
yeah.
Right. Do you take into account factors like lifestyle, medication that patients take? What would you craft around such a protocol?
Most definitely, we look at the lifestyle. So in smokers, it's pretty difficult because it's, for example, a large amount of free radicals intake in smokers. So we can say that smokers per se are non-suitable patients to have ceramic implants, for example. They should be cutting that habit or switch to vaping or anything that's less, I wouldn't say it's good, but it's less toxic and less harmful for the body. Lifestyle as well. So here comes nutrition and exercise in the sense of not going to the gym, but in the sense of outdoor movement, you know, like endurance or yoga or anything. Just
So you do examine other parts of the body, like you do look for scarring, posture, should we say, if there's any form of cranial tension in that patient, would that interrupt anything in the jaw area?
So in the overall questionnaire, we tick off nutrition, we tick off exercise, we tick off the scars Furthermore, the next step is always the interference field diagnostics. We'll get to that later on. But what many people don't realize, that scars can actually block the flow of energy in certain meridians, which can be quite easily restored. So scar deblocking is among the first things we do with our patients.
So could you be a little bit more specific as to how would scarring affect the teeth?
The teeth, I mean, it's an overall thing. It's an energetic aspect and an energetic imbalance. If let's say one meridian is affected by some scar, it may also, if that meridian is running also through the jaws, it may cause like regional, let's call it energetic weakness or energetic imbalance that may affect, for example, the gums. Right? You have chronic inflammations that just wouldn't heal, and no one knows why. So you just have this weak spot.
That's very interesting.
Yeah. And it can be easily cured by just restoring the proper flow of energy.
And that's related to the meridians of the body.
It is.
Absolutely.
Yes.
Interesting. Okay. So has your philosophy changed over time, or was it always integrative?
As said, I've started as a traditional dentist, and these let's say I wasn't satisfied with my books anymore, so I knew there must be something more to it than what I've learned so far, and that's when I've turned to holistic medicine, to acupuncture, and to biological dentistry.
And do you find that changing these methods, you had much better results with your patients? Were they more happy?
Well, basically it's a completely different approach, and also the patients that are coming to visit me, they have different demands. They don't want like only structural rebuilding, restoring of the chewing function or aesthetics. They want like a healthy mouth, a healthy jaw, healthy jaws in general, and they want it in a biological setting, so they know, okay, this is not harming me. That's one of our very basic aspects. We don't want to do any harm with the materials we use, basically, or with the treatments we do on the patient.
So what alternative or bioenergetic diagnostics do you use to evaluate this?
Well, as an acupuncturist, I'm particularly working with the pulse reflex. So if I put certain frequencies with a laser on certain areas where I suspect, oh, this tooth could be an interfering one, energetically interfering. For example, if it's root canal, and I got this pulse reflex, I say, okay, it is actually interfering. But as said, it's more a qualitative test. It's not a quantitative test, and that's where your bioresonant diagnostic is getting really interesting, because you can really figure out, is it the cavitations, is it more the root canal tooth, or is it something completely different that gets the patient out of his balance, isn't it?
Absolutely, yes. I mean, I think this is a very, very important evaluation, because we can definitely evaluate with bioresonance whether a patient has an overload of parasites in the mouth, or a thrush, for example, or an overload of bacteria, candidas. That causes a very large interference. So by measuring this, it gives us definitely the ability to know what therapy to give to this patient and what form of detoxification is necessary to bring that balance, which I believe is very important.
Most definitely. And you can also measure the vitamin and trace mineral levels, right, with this very same device.
Absolutely.
This is fascinating. It's so amazing.
And even more importantly, we can actually measure today what heavy metal poisonings we have in the mouth. So if somebody has got a very, let's say, old form of amalgamation, which has nickel, cadmium, mercury, and it's actually poisoning the gum area, and the client is actually swallowing that, or the patient, we can detect if there's a poisoning within the tooth and the body itself. And this is the recommendation that we want from you. Do we remove amalgams today, or do we leave them in the mouth?
What a question. I'd say definitely it needs to be removed, but with the proper under proper circumstances. So I think, will we get to that later on, or?
Definitely, we'll get to that and explain the procedure as to how we need to get to the removal of amalgamation.
Yes.
Was there a diagnostic tool or method you discovered that changed how you treated your patients?
Well, ever since I use this frequency laser, I mean, it opens so many possibilities, because you can not only detect dental interference fields, you can detect in the limbic system on the earlobe, you can detect emotional interference fields, and that's basically trauma therapy that we're doing.
Wow.
So the thing is that we can, in the limbic system, on the earlobe, we can split the memory from the actual emotion. So if the patient is thinking of this particular trauma or whatever he has experienced, there's no need to be talking about it or discussing it in the sense of psychotherapy, but we simply delete the connection between the feeling, the emotion, and the memories. So the patient can still be thinking of it, but it's just like a matter of fact, it's not doing anything. It's not causing these emotions anymore. So this is basically it's quite an easily applicable tool to do, and it immediately boosts the patient's energy. There you can really feel this shift. So they get their energy is more like, how can I say, they're more centered, they're more grounded, because there's these energy blockers that's
just been
gone.
Released.
Yeah.
So do you actually do this before you start the treatment in the mouth? Do you actually measure to see how stressful that patient is?
Yes.
And would this be tested and evaluated according to the bite of that patient?
To the
bite?
Not really to the bite, no. We just, the thing is, we do, the first thing we do is we get an X-ray scan, a 3-dimensional X-ray scan, to be evaluating like the structural components. When there we can also see the if there's any bite issues or such. We can see the chronic inflammations, such as the cavitations in the jaws, the FDOJs, the fatty degenerative osteonecrosis. We can see root canal teeth, and the information given in a 3D X-ray is much more, it's like 1,000 times more than in a simple panoramic.
That's correct.
And when we've discussed that, we immediately move to the interference field diagnostics. So we deblock all the scars. We have a look at the emotional interference fields. Remove those. That's I always call it. It's like an onion. It's various layers, and you need to remove the layers one by one. So that if you remove one thing, one issue, and there is no pulse reflex anymore, other things tend to come up. And you do this until slowly until you get to the core.
Oh, basically. That's wonderful. So not only do you fix a person's teeth, you also fix their emotional factors.
Well, basically the thing is, if we want to ensure, or if we want to have the best outcome for ceramic implants, basically, we need all the energy for good wound healing, and not only on the nutritional level, but also on the energetical level.
Absolutely.
And if there is like decades of anger or disappointment or an unhappy marriage like 20 years ago, the people really still suffer from, but they put it in some drawer, like down somewhere beneath.
Absolutely.
Yeah, and the symptoms are popping up still, and that's one thing we need to fix, because we need the full energy, not only immunologically for the wound healing, but also energetically. So all these energy suckers need to go away.
And how many sessions would that take?
Well, to get there, to get a relief, I've treated patients with severe dentistophobia that haven't been to the dentist like for 15 years because they had some traumatic experience. I got that away in 2 sessions. So 2 hours, 2 times an hour, and they were ready to have dental treatments done again. So, okay, doing this like really deep emotional deblockage will take 3 to 4 sessions to get to the core of the onion.
Depending on how deep it is.
That's right.
Right, correct. So
yes, it's different in every patient.
In every patient, it's different, definitely.
Yeah,
so you actually unleash the subconscious trauma of that patient.
Yes.
To get to the root cause of that problem that they have.
And to make them ready for surgeries or whatever needs to be done. And also it's a way of treating bruxism as well, because most of the bruxism is like it is emotional aspects, and this
is amazing. I've never heard a dentist ever speak about this. I've never heard a dentist ever say to me that any form of connection of emotional trauma has to be repaired before we can even begin working in the mouth. And I'm so excited about this, because I think that we're going to help a lot of people.
We definitely will. Yes.
So that's very interesting. Thank you so much for that. So what materials do you prefer for fillings, for crowns, for implants, and why? Why would you be using materials?
As biological dentists, we tend not to use any metals anymore. And when it comes to dental implants, zirconium is our material. I use the zirconium implants by SDS Switzerland because it makes the most sense to me, number one. Number two, it's got a special, from mechanical aspects, zirconium has to be treated and regarded differently from titanium. So if you take the shape of a titanium implant and just put that into zirconium, it wouldn't work, because zirconium is a completely different material. And this has been taken into consideration with the SDS concept. And the implants have a bigger diameter, okay? And they've got this really sharp thread. So if at all, in the first place, it'll not grow stable. You can always screw it. Yeah, screw it for a second time. Mm-hmm. No need to put it out, or you just re-screw it and then it'll grow eventually. So this is why we switched to that concept, as it's all in all the SDS concept by Dr. Ulrich Volz. It's the one that makes the most sense for me, because it takes into consideration all these other subjects. For example, the nutritional aspects, the mechanical aspects, biocompatibility, which we're all about.
That's cool.
Not only in the implants. So also when it comes to crowns or bridges, either on implants or natural teeth, we tend to use zirconium-based crowns or bridges. So we have a zirconium core to give stability, and around it's traditional dental ceramics, which have to be compatible with zirconium to give like a little translucence or transparency in the aesthetic area. For fillings, Me personally, I refer to the resins and composites that are being recommended by the German Association for Biological Dentistry, by the DEGUZ, it's called. It's basically called environmental dentistry in German, but it's basically holistic dentistry. And studies have proven they don't use certain acrylates that are harmful to the pulp and cause in many patients these like sensitivities after getting these certain fillings that will go on for weeks or months even, or that can, in the worst case, lead to pulpitis, and the tooth has then to be root canaled, which we don't want, which we want to avoid at any costs.
Right.
So these composites they're amazing.
Very safe.
They're very safe, yes.
So it's right to say that zirconia is completely compatible with the body, and it's not poison. It doesn't poison the body. It's not lethal in any way.
Yes, there's no other material that has been proven to be in such a way biocompatible and safe. So because in titanium there's always this code that's reacting, this alpha case code, number one. Number two, we always have small titanium particles that dissolve in the bone, and that are actually causing this what we call titanium associated osteolysis. Mm-hmm. So the bone degrades around titanium, and this doesn't happen with ceramic at all because nothing dissolves, because it's a clear surface, and it stays stable and it's absolutely compatible.
So can you actually remove a titanium implant and replace that with a zirconia? Is that an easy repair system to do? Is it difficult?
Basically, it's easier than removing a natural tooth, because there's this thread and you just need to unscrew it. Not such as a tooth that needs to be like taken out using much more force than a titanium implant. What needs to be done is to be clearing the bone cavity after taking the titanium implant out. You need to clean out the bone cavity in order to remove all those titanium particles that are scattered all around the bone area.
So you can actually see the particles in the gum area?
Not macroscopically, but microscopically you can see them actually, yes.
Okay, so and how long would it take if you have removed the implant from a patient for it to heal and then replace it with a zirconia implant?
Well, we tend to do this at an immediate basis. So also we do immediate implants. So we remove tooth or an implant and put the implant in the same session, for the following reason. If we remove a tooth or an implant, we initiate like this wound healing. All right. And if there's not other massive bone loss in the area that doesn't allow us to put immediate implants, why should we initiate this wound healing reaction twice? So if we clear it out, if we clean it out, if we use ozone, which is recommended in the protocol, essential part, use of ozone.
Excellent.
For disinfection purposes and for metabolism enhancement, there's no better thing than ozone. As well as the use of PRF, so platelet-rich fibrin. We draw the blood. It's being spun in a centrifuge, and we use these cloths that are rich in stem cells and growth factors.
Excellent.
And that's being put around the implant wherever there's still a small gap. Mm-hmm. And that's basically the protocol. We also save one surgery session for the patient.
Absolutely.
So, yes.
Would there be a preparation for this before you would start? Would you prepare the patient the immune system, for example? Would you prepare that patient to have a high immunity for any heavy metal toxicities? Would you make sure that we have a very strong bone structure, that there's no porous effect in the actual bone? Would you supplement that patient a month before they have the removal of the titanium?
Most definitely. I always recommend to start an anti-inflammatory diet, including those bone supplements we've been talking about, a month beforehand, to make sure everything's in place. And depending on let's say how compliant the patient is, or in which way he used to eat, or which lifestyle he had, it may take up to 3 months to get these people into the state that they're actually ready for surgery.
Correct.
So this is number one. The detox we always do afterwards, because if we open up the cavitation, there's still more heavy metals and other things to come. So I always tell it is like you have a waste dump somewhere, yeah, and you're steadily cleaning the roads without removal of the waste, the dump itself. So it's better to first remove the waste dump and then clean it all.
Absolutely.
You know. So
absolutely.
we also give the infusions that are an essential part of the protocol. So we give infusions 1 day before surgery, on the day of surgery, and 1 day after. Those are alkaline infusions with high dosage vitamin C, with magnesium, with glutathione. I put always glutathione as well, as a very strong antioxidant. We use Tromail.
Excellent.
You know, Tromail. We use a bit of dexamethasone to
calm the patient.
to take this inflammation, like this reaction spike, to calm it down a bit.
The adrenaline.
Yes. We use a bit of procaine also to get them in parasympathetic state, and it works out quite well. Most definitely.
So by using these intravenous effects, you're going to obviously have a much better outcome in the repair.
Yes.
And the healing process.
They definitely do. Yeah.
Oh, this is very.
We sort of give an overdose of vitamin C to make sure everything's in antioxidative state. Let's put it that way.
That sounds amazing. Honestly, I'm so ready to start sending you patients. I have so many patients that are in need of this.
That's great.
Type of therapy.
That's great.
Okay.
Well, we've also been talking about the ozone. We use the ozone also for treatment of initial caries instead of fluoride. So in these brown spots or discolorations.
Yeah.
When you're not sure, when not everybody else, but the traditional dentists would put fluoride. We completely keep from using any fluorides, and in hypersensitivities we use either acupuncture or the Bach flowers.
Of course, yes.
The corresponding flowers.
Absolutely. For emotional factors.
They're great. I mean,
fantastic.
Many people don't believe in it, but as soon as you see the results, basically there is no other thing, and you see it, and okay, it works.
and the good thing today with bioresonance, you can very easily analyze which back remedies a patient needs.
Incredible.
Because every patient is different.
Yeah.
And their protocols are different, so we know exactly which cocktail we need to give them. Let's say before they come in and do a therapy.
Okay.
Which is really good as well.
I mean, we test them kinesiologically, but if you get the results from your computer, from your bioresonance.
Absolutely. So
that's amazing.
Are you also against or for whitening of teeth?
Well, yeah, it's really it's strongly recommended by many people. I say, okay, just get your teeth, get a professional teeth cleaning, and you realize whether you like the color of your own teeth or not. I mean, if you don't do it like every 6 months or so, it's doable. I don't do it personally, but I'm asked a lot about this topic from patients, and I said, okay, if you absolutely need it, then just do it, but
So-
don't do it too often.
Would ozone help? Does ozone actually help to whiten the teeth, or not necessarily?
And I haven't really heard about that. No.
Okay, that was just a question.
No.
Okay. Have you ever had any patients react to a dental material in an unexpected way?
Ever since I used biocompatible materials, no. I mean, there were reactions when I still did root canals, reactions to the sealer or to the root canal filling, and yeah.
So all the biological material that you use are far more compatible, less toxic, more friendly to the patient.
That's what they're made for, yes.
So there's less side effects, and of course there's less interference in their immune system.
That's it.
Oh, that's
Definitely.
really good.
Yes.
Fantastic. Okay.
Yes, and also the root, talking to about the root canals, we start them as some sort of first aid, because if the patient is in pain, has an acute osteitis, and the tooth needs to be opened up, we start the initial process of root canal treatment. So we open it up, we clean it out, we put some medication in, but we don't finish it. We just leave it there in place so that later on it holds the space. Basically, it holds the bone for later implant, for later putting off the implant. Because if you remove the tooth straight away, and you then start your planning about implants, the bone starts to fade and decrease, yes. So it's better to leave it in place, keep it safe, and then remove it and put an immediate implant.
And how healthy is it to have a dead root in your tooth?
Well, that root canal teeth are the most often occurring dental interference field. So they are producing toxins 24/7 through these tens of thousands of micro channels. So it's not only the central canal that's being filled, but it's literally, it is impossible to do a safe root canal. It is impossible because there's so many side canals, and okay, they say that rinsing or laser disinfection or whatever, but the root canal tooth will keep spreading toxins as long as inside the jaw. And traditional or orthodox dentistry is literally the only medical field where a dead organ is allowed to stay in the body. So imagine you just
Off your finger.
yeah, you would never like, oh, let's put some paste on and let's try to save it, let's keep it that way.
Yeah.
It just goes, it's off.
So does the dead root canal attract bacteria?
Well, the blood flow is interrupted, so there is no immunological interference anymore, and dead teeth are full of bacteria, full of fungi, anything, and as said, you will never reach 100% filling of all those tens of thousands of channels. So per se, it's paradise for bacteria. It's warm, there's nutrition all around, so they will grow.
So that obviously comes with a lot of side effects like headaches, not feeling well, fatigueness.
That's various side effects that may appear, but these fatigues is basically what most of the patients report, and it's I think it's rather this systemic and energetic aspect that really creates these fatigues. If the root canal is not being done properly, you could as a as a traditional dentist, you could be advising them to get the root canal redone in a better way, but you wouldn't change the basic problem. So
And how do you test whether that root canal has decayed, or it's the area has decayed, or that it's causing a problem
well,
to the patient?
we do the interference field diagnostic with the special laser frequency. I put the laser frequency for dental interference fields. I approach the tooth and I forget the pulse reflex. Okay, it is interfering. Okay. If I get no pulse reflex, it's not yet interfering.
Right. Okay.
And you use the bioresonance, right?
Absolutely. Yes. Because it's always causing a problem.
Yeah.
I mean, we can see that. We can see the buildup of mycosis. We can see the buildup of candidas. We can see that people tend to bite their tongues because of the fill-up of fungus on their tongue. So their tongue's always white.
Okay.
And once we look at their tongue, you can see that there is a jit on the left and the right side. It's not straight anymore. The tongue actually expands. And because the tongue expands, they cause a problem to the hypoglossal nerve. So we're starting to have speech impairment. And these are the difficulties that we actually see in patients that have these root canals. So the best recommendation is to remove that tooth and to put a zirconia implant. Is that correct?
Wherever needed, yes. And yes, we don't need every single tooth replaced. We can also put like bridges, for example, like implant, pontic implant, and also the second molar doesn't absolutely have to be replaced. The first molar, for stability reasons, has to be replaced. There's a reason why in the upper jaw the first molar has 3 roots, yeah, and in the lower jaw the molars have 2 strong roots. That's because there was a massive load, and that's why we absolutely need to replace up to the first molar, definitely. Okay, the decision between saving and removing a tooth.
Very interesting. That's a very big question.
Yes, right. So if the tooth is definitely an interference field, it needs to go. If it's chronically inflamed for whatever reason, it needs to go. If it's some sort of like ectopic, or if it's not in line with the other teeth, and the patient is not willing to do like orthodontics, let's say an adult person with some misaligned tooth, I mean not the aesthetic thing, but like purely the functional reason, I would also recommend him to get those teeth removed. So, but it's a bit hard to say. So it's always an individual decision,
Absolutely.